We're fortunate right now where we do have capacity and we're able to manage, but again, as Sheriff mentioned, it's really important that we plan for a potential serve that could, in the worst case scenario, overwhelm the medical community. So again, this is in preparation of making sure that we have the reserves to care for patients in our community. It's also important to understand that the Medical Reserve Corps will not be caring for patients with COVID or other serious conditions. These are people that will apply in the appropriate setting as a way to help extend staff if the opportunity is required. Instead, they can help with patients who are not critically ill, help with things that are more simple, such as vital signs, transferring patients, potentially vaccination in the community. But again, the most important step is identifying potential individuals that could serve in that capacity. We realize this sounds a little bit unconventional, but it is standard practice. Our staff, as Sheriff Knezovich mentioned, are tired over 9-10 months of providing care. And we want to make sure that if the need arises that we have a backup plan. We've had pretty extensive planning with our regional partners, including Multicare, at developing contingency staffing plans, both for physicians and providers, as well as caregivers, nurses, techs, et cetera. As Sheriff mentioned also, we're seeing a critical situation in California. We've seen shortages in New York, and we want to be prepared that in the event of that we have staff to rely on. We're seeing that right now in our Providence hospitals in Southern California, and so we want to be proactive in making sure that we have what we need to meet that need. Dr. Chen will speak further on behalf of Multicare.
Thank you, Dr. Getz. Good afternoon, folks. I'm Dave Chen. I have the privilege of being the Chief Medical Officer for Multicare Deaconess and Valley Hospitals. Throughout the pandemic, we've worked closely with our healthcare partners and specifically with our colleagues at Providence. This call, this request for Medical Reserve Corps volunteers is really the next step in ensuring that we can care for our community and continue to care for the patients as we see a potential rise in patients not only with COVID but also without COVID. It's been stated already, but I think it's important to reiterate that the Medical Reserve Corps volunteers will not be caring for patients that have COVID. A lot of folks have asked during the pandemic, though, boy, it sure would be nice if we could help out in some way. And so this really is an opportunity for our community, our folks that do have experience in medical care, to participate and help out during this difficult situation. As the sheriff said, we're really preparing for the worst case scenario. And while we're not in that situation at this time, really as healthcare leaders, it's our responsibility to look at really how do we prepare and plan for things that might occur in the near future. And so that's our appeal for the volunteers at this time. At this time, I'll turn it over to Dr. Velasquez.
So good afternoon, everybody. Is being active in immunizations, is being active at Bloomsday, is being active in a variety of events and services to the community. It's not a new thing. So to answer your question of how can you help, if you're a physician, a nurse, a trained practitioner, someone with medical background, mental health provider, area therapists, phlebotomists, technical staff that has skills people that can help with everything from transportation to logistics, please volunteer. This is a good time for you to do so. It does take a little bit of time to go through the process, so I will encourage you to do that now. And it's not that we are, as the sheriff mentioned, we're just getting ready in the event. If we don't have to use it, that would be great. But our goal is to be ready and make sure we have the resources to support our healthcare system, which is critical at this point, as has been and going forward. So with that, I will ask Sheriff Kanasevich if you could come and close this meeting.
Here shortly we'll be releasing a public service announcement to all of you to run on your multiple channels and social media and everything else in a way to reach out and get more people to volunteer for the Medical Reserve Corps. You know, we all have life skills that we develop over time. At one time I was a United States combat medic in the Army. I know that there are combat medics in this community. This would be a great time to step back up and help your community and serve one more time, one last time to get us through some of these rough times that may be heading our way. And again, our whole idea of doing this is to make sure that we aren't in the position that some other communities have found themselves in. We want to prepare our community, and the doctors and hospital systems that are represented here are all in that same mind frame. We want to make sure that we have the assets and we have the people that can keep you healthy when we need it the most. Any questions, comments? We'll take any questions right now. Try to keep the questions narrowed into the Medical Reserve Corps. I know there's a whole bunch of COVID topics we could open up to, but we're focused in on trying to get people to volunteer to help our community.
So let's say somebody, you know, they have experience with something like logistics, something that isn't directly medical related, and they think there's a way for them to help, but they're not really sure exactly what it would be. What's that process like of actually figuring out which people are useful for the Corps and which people, like, maybe those skills aren't super helpful for us?
Doctor, you want to answer that one?
You know, I think if you have something to offer, I'd encourage you to volunteer. You know, I think part of the process is identifying the talents, the gifts that people bring to the community and seeing if there's a way we can use those to help provide care. Again, it's not a sure thing that will require this, but I think the more hands on the deck is the better, especially as we try and decide if we do need this resource, how can we best apply it. So if somebody's interested, I would encourage them to apply if they think they have something to offer.
Do you have any sense of how many people are currently in the Corps?
Jerry, do you have 50?
With activities of daily living. They otherwise might be going home or getting home health or placed in and so they remain in the hospital. You know, the staff that are taking care of the other sick patients are continuing to care for those, and so getting folks that can help kind of in that transition area would be an area that would be really, really valuable for us right now.
What are some of
Dr. Vasquez, would you like to talk about that aspect at all?
Sure, thank you. So, skill see they're
Yeah, I think again it gets back to preparation, and when we talk about these contingency plans, we really do plan for a worst case scenario if we start transitioning into a crisis. I think we're positioned well as a community, and so I think that likelihood is low, but you can never have enough help, and so we don't want to be put into a position where we didn't anticipate or have the resources in place to match that need, and so this is another step, I think, in ensuring that we have what we need to care for the community.
So you said the planning began about a month ago. What instigated at that point? How come not, 2 months ago? Why was it 1 month ago the time that you guys got together and said, hey, maybe we should look at this?
It's what you call the holiday season. We all saw that potential coming. The hospitals took great effort to pull everybody together, and I really thank them for the job that they've done in this process. I thank Dr. Vasquez and our health department for the work that they've done. Emergency Management, Department of Emergency Management, we has worked diligently over the last month to, again, you've seen it, you all cover this. You see the same things that we see on the news. We see that we had a spike after Thanksgiving. Well, that last spike isn't quite here yet. We still haven't cleared New Year's, Christmas. Those spikes potentially could be within the next 5, 6, 7 days. So that's why a little over a month ago we started talking about what if. And then we started watching what was happening going on around the rest of the United States. We saw what was transpiring in California. And our goal is not to allow our community to suffer that same fate.
What are the ways that people that don't have any useful skills or that don't have a medical degree, are there ways that they can help, or you foresee yourself tasking them into certain roles if this becomes a bigger crisis?
So let me.
Yeah.
So we all have skills that can be helpful, because if you think about it, could be transportation, it could be logistics, as you mentioned, it could be just helping move something. So there's a lot of things that people can do. People that have backgrounds in education, for example, could spend time if a child needs to be read a story. So there's a lot of things that we can do as a community that don't require a medical background. And I want to make a little bit of a point, because what we're doing is what I would refer to as stage appropriate, always trying to be ahead of what could be a next stage. We're not saying it is. We're saying it could be a next stage. But several weeks, we've been anticipating and preparing. But the reality of the matter is that our healthcare providers at all levels have been going through this for almost 10 months nonstop. And we want to make sure that they can continue taking care of all the patients that require the care, because not just COVID patients. We have lots of other patients, and we've been taking good care of all of our patients regardless of what their illness is, and want to make sure that we can continue doing that. So for them to be able to do that, we need to provide them care in some of the activities that perhaps they don't need to do, because someone with some qualifications can step in and be helpful. So I just wanted to add that, because I don't want us to lose sight of that concept of stage appropriate.
Are there anything that, are there other communities that have done something similar, maybe that have been hit harder, that we could look to as here's an example for what this could look like in Spokane?
You want to reframe that just a little?
Yeah, sure.
more?
I'm just wondering if anyone else, in terms of getting volunteers as part of the Medical Reserve Corps, tasking them with some of these different important tasks, are there other communities that have done this that we could look to as an example to explain or look how what's worked, what hasn't?
The Medical Reserve Corps is a statewide organization, if you will. It's not. It's every county kind of has that. So we've had it since 2003. The other counties have had it. I don't know what their histories are. So what we're looking at is what we already have in place. We're just trying to strengthen that. But to answer your question as far as do we pay attention to what's going on in other communities? Yeah, we do. That's why we're here. That's exactly why we're standing in front of you. We have watched what's happened in other communities, and we're trying to take every effort that we can to mitigate any of those challenges that they face and make sure that our community doesn't face that same challenge.
I'm just wondering if any of those communities you're aware of have tapped into a volunteer network of sorts that we could look to.
I haven't gone that deep, but I've watched what's happened in the communities. I don't know if they have Medical Reserve Corps in let's say California or New York, but I know that we have them in the state of Washington, and I know the Spokane County's had one since 2003, and that is our next move is to prepare and to bolster that reserve.
Do we have a sense of how fast, the possibility of this new strain, do we have a sense for how fast it might spread or impact Spokane? What's our timeline look like?
Danny, we're really not prepared to deal with the new strain questions. We're trying to narrow the questions right into the Medical Reserve Corps and why we're staying on task as far as our planning on how to get our community through the current dilemma. These folks are always taking a look at new strains, what that data looks like, and we will be feeding that into our models as we progress throughout our planning sessions. So today it's about Medical Reserve Corps. Talk to us in a few weeks when we get our hands a little bit more around what the new strain actually looks like.
Before you mentioned Medical Reserve Corps, I think you mentioned Bloomsday. They helped them with inoculations. What's some more examples of the kind of stuff that they normally do, maybe pre-COVID?
Suicide prevention, sorry. I thought we were just having a conversation, you and I. Suicide prevention is another area. Vaccinations is a really, really big area because it's important for that. And big events like Bloomsday. So there's multiple ways that these folks can and have been helpful. And we have a history in the community of that for many years. So we're just looking at, as the sheriff said, stage appropriate, be prepared, and make sure that we have enough critical mass in the event that we need it. And if we don't need it, that's fine. We'll be ready for whatever comes next. Thank you.
This is a fairly, everyone's wearing masks here, and it's a fairly small room. Not a lot of room for social distance, maybe 20 people in here. I'm just sort of wondering, how safe are we in here right now?
Good question, Daniel. The reality is in order to communicate with the public, sometimes you reach out, you have press conferences, but I want you to think about it this way. We're also asking people to step up in our community and help out in hospitals and everything else. Can we protect and guarantee safety across the board? No, we can't. But when it's this important we're going to step up and we're going to show you the importance of coming forward and asking for this this volunteer effort. So I can't tell you how safe you are, but you're here.
I just didn't, I don't want to, you know, infect the sheriff or infect a member of the community or anything like that. So I'm just wondering if, you know, could we have done this on Zoom or outside, or, you know, I told my mom I couldn't visit her for Christmas. We had to do Zoom Christmas, and that was hard for her. And so, but here we are.
And here you are. You made that choice. Any other questions? All right, thank you.
Yeah, don't forget your microphones, or whatever.
The mics, yes.
Actually, the student